everyone could mute themselves as well, please, that would be very helpful. That will stop any feedback or any hearing anything in the background. Thank you very much. Hello, everyone. Welcome to this afternoon's press conference, the 28th of August. Thank you for attending today. We are doing things slightly differently today in that we have asked for some questions to be submitted prior to the meeting, and we will be referring to them shortly. The order of running is going to be, we're going to go to Lucy Whiteman, the Director of Public Health, for her weekly surveillance report. Then we will go to Jonathan Nunn to give his view on the local situation. And then we will look at the questions that were submitted in advance and if there's any further information required as a result of those questions. And then I will bring members of the press in for further questions if they are needed. And if everyone could please use the hands up facility on the participants and chat group, that would be very helpful. Thank you very much. So without any further delay, I'm going to pass to Lucy Whiteman to give us her weekly surveillance report. Lucy.
Can you hear me?
Yes, Lucy, we can hear you.
Super. Apologies, I was making sure you are unmuted. And I'm hoping you can also see the first page of the report there.
Yes, we can. Thank you.
Super. So obviously, as we normally do, I'll go through the report. So we've got obviously our continued messaging around the fact that we've got increasing cases in Northampton, Corby, Kettering and Wellingborough. And obviously we're asking residents of those areas to obviously adhere to those additional requirements around social distancing, hand hygiene, socialising outside of their household and working from home if possible. So we know that obviously Northampton Borough continues to be an area of intervention, and that in particular that Green Corps employees and their household contacts are required to self-isolate until next Friday. So as we talked about, incidence rates in Northampton have been increasing, and for the first time in a number of weeks we've seen a decrease. So particularly in Northampton Borough at the moment, we've got an incidence rate in the week up to the 23rd of August of 37.8 cases per 100,000 population. So clearly there has been a sort of a Green Corps effect in Northampton, where we've seen a significant spike in cases. And because that's quite a discrete community, the transmission at the moment appears to have remained within that quite close community and hasn't actually translated into the wider population, which is very fortunate. At the moment, the Green Corps factory remains closed to the majority of the workforce. However, they're running a small production line with people that have been approved by the Department of Health and Social Care, Public Health England, myself and the environmental health officers to return to work. And obviously we continue to work with Green Corps to ensure that their high standards are continue to be maintained. There's a quick summary of the public health measures that we continue to undertake and as and where we are focusing efforts. And obviously these are the messages that we're reiterating again to the residents of Kettering, Corby, Northampton and Wellingborough to make sure that we can obviously reduce the risk of onward transmission. People understand obviously what we've got in place at the moment and what the context is, and locally obviously people will remember that we've launched our own contact tracing service, which has been very successful in the first week and is providing us with not only the ability to engage with residents locally to remind them of those self-isolation requirements, but also to start to gather soft intelligence about the likely sort of origin of their viral contamination. So it helps us to build up a picture of where these cases might be arising. So the data itself, if we come on to that, obviously this is the week between the 17th and the 23rd of August. We've now got 4,235 positive cases in the county, 161 being identified in that last week up to the 23rd. So Pillar 1 testing identified 39 in that last week, Pillar 2 identified 122. From a point of view of the age breakdown, Obviously, we know that Pillar 2 is the primary community-based identification mode, and people will notice, obviously, that still is very much focused on the working age population. But as you'll see from the bullet points at the bottom, that there's been an increase in cases in the under 18s age group in recent weeks. Now, I've referenced that a couple of times, but we've seen a more significant jump in that last week. And obviously, we're working with our schools team to make sure that the impact of people starting to socialise, and then obviously the greater impact potentially of them returning to school, is obviously being mitigated wherever possible and will be continuously monitored as and when schools reopen. So from a point of view of our number of cases, you can see again where those cases are and where we've had an increase compared to the prior week. So that increases in Corby, in Kettering and in South Northamptonshire. So South Northamptonshire, again, you can see still very low numbers, but an area that we continue to monitor. Corby and Kettering, obviously areas where we're now, for all the reasons that we talked about before, making sure that we've got focused efforts across this bank holiday weekend and into next week to make sure that those messages are being reiterated. Obviously, with a bank holiday weekend and payday combined, there is a risk that people will forget some of that important messaging. So we've got wardens out there with our environmental health and our licensing officers and our police colleagues, making sure that those messages are being reiterated and enforced where required. So slide 10 shows us those cases, as we always do, by a rate. So this allows comparison between areas. So again, you can still see Northamptonshire as a county is statistically significantly higher than the England rate, which obviously remains a concern. Kettering and Corby, again, because this is cumulative over the period of the pandemic, still has those higher numbers. But you can see Corby and Wellingborough creeping up there as well. So continued areas of focus. I really can't reiterate that enough, that people cannot be complacent here. And the data is demonstrating the fact we're still not on top of this locally. So this is the cumulative cases by boroughs and districts. So this is again since the beginning of the pandemic. You can really see the effect of Greencore with that steep increase in cases in the last fortnight for Northampton. Obviously even more marked when you look at it as a rate for Northampton. So you can see how that has been contained within that particular outbreak area, but you can also see on the grey dashed line the impact that that's had on the Northamptonshire rate, and a similar little sort of surge in numbers with regards Wellingborough, where we obviously know was the second highest area impacted with COVID cases due to their place of residence. Again, we've got slightly skewed data here, as we talked about previously, because we've got the cases being allocated to the Malton ward, which is where Greencore Factory actually is, rather than the actual home addresses. Again, we've provided the home address information appropriately to environmental health and licensing officers, so people are aware of where the residential addresses are, so that we're able to monitor and manage the risk where that exists in our communities. And similarly, the rate is slightly skewed, but obviously, again, reflected in our Victoria and Isbrook, Abington, St David's being areas of focus. We know that these are areas that have continued to provide challenges from point of view of the level of incidence of COVID cases. And that, again, is still reflected in the last 28 days. So cumulative cases, obviously the greatest number being in Malton for reasons we've discussed. But again, Cliftonville and Rushmere, and then Kettering Town and West and Victoria and Isbrook still being really high on our radar there. So again, continued enforcement from a point of view of having our AHOs and our community wardens out in areas of high incidence to reinforce those messages. Again, reflected similarly in the cumulative case rates per 100,000. So even when we compare areas, we've still got areas that are significant hotspots. From a point of view of outbreaks, just like to bring your attention to the fact that we wanted to provide you with the most up-to-date data. So this is as of the 27th of August. So we've now got 21 active outbreaks in the county, 11 being in care homes, 7 in workplaces, and then others obviously distributed elsewhere. Obviously want to reinforce the fact that an outbreak is 2 or more cases linked by place and time, and particularly in the care homes, those are associated with that proactive ongoing testing regime that's being completed. And many of these are asymptomatic residents and staff, and it obviously just reinforces the importance of that proactive approach that the government have taken, because it allows us to identify people where they aren't symptomatic. Obviously, it's more challenging in places like workplaces, where again, we see a high level of asymptomatic carriage. And you can see that playing out with the slight increase in the number of workplace outbreaks in that last period. As I said, slightly longer period, but because we wanted to give you the most up-to-date information that we have at our disposal. So exposures just being a single case, and then clusters obviously being 2 or more cases, but where there's no link in relation to time and place. So again, we not only discuss these at our daily in IMT meetings, but we also have a dedicated outbreak meeting once a week with Public Health England colleagues, Health and Safety Executive colleagues, and local environmental health and licensing colleagues. So from a point of view of our ongoing actions, obviously we've talked about tracking those outbreaks daily, and then also making sure that there's a dedicated weekly meeting. We're drilling into that postcode data so that we understand the reasons for the increased level of infection in the hotspot areas. As I said, the local contact tracing service is also helping to provide soft intelligence in relation to that. Again, we get feedback from the community wardens who are out there supporting the police and environmental health officers with regards to levels of compliance and where they have areas of concern. And we continue to obviously work with all of our employers locally to make sure that wherever possible, we're mitigating the risk of outbreaks. So if I stop there, the rest of it is, as you know, the links to all of our information and our other data sets, etc. So happy to take questions, but I know we've obviously got a set of questions that we might want to start with that's already been submitted.
Thank you very much, Lucy. Very comprehensive as always. I'm going to bring in Councillor Jonathan Nunn, the leader of Northampton Borough Council, to give his view on the local work being undertaken, etc., etc. And then we'll come back to the questions, a lot of which may have been answered from your presentation, but we will see as we go through. Jonathan.
Thank you, Ian. Thank you very much indeed. And gosh, we are by no means out of the woods. We've a long way to go, but it can't be anything but an encouraging or frankly, personally, huge relief that we now have seen some decrease in incidence rates, and that's got to be welcomed. Perhaps at that point we should pause and thank residents and businesses for the tremendous effort that's being undertaken across, I speak specifically for the borough of Northampton, but of course across the county. We know the great lengths that people are going to, and whilst not taking our foot off the gas, let's thank everybody for everything that they're doing out in our communities and our businesses. I do think the second part of that is the tremendous activity that we see going on locally. It's a thanks to all those involved in the effort across councils, public health, the NHS and so on. Clearly the local tracing is proving successful. As indeed is the testing, and as the testing continues to be at good levels, with a lot of people making the effort to get up there on the market square if they either have symptoms or if they have concern that they may have been exposed to the virus. People are doing that in good numbers. But of course, following the Green Corps outbreak, the need to hit the industrial areas, I think we would say it's a success, the testing at Grange Park, and actually tremendously reassuring. But numbers of positive cases, those have not been some of the high levels that we might have feared following the Green Corps outbreak. That testing, of course, now moves to Brackmills, and that's tremendously important because at Brackmills we've 14,000 people working in a largely industrial type setting. So we cannot afford not to do that to ensure that area is being properly looked at. We benefit on Brackmills, of course, from the tremendously well organised Brackmills Business Improvement District, of which every business is an active member, and their ability to coordinate tests. And I'm certain that testing centre will be extremely well used when it opens for business next week. So I think generally the message is a big thank you to everybody, but please an assurance that we're not just looking to get back to this sort of level. We're not looking to get back to national averages. Let's absolutely smash through this thing and make Northampton and Northamptonshire a safe place to live. So it's more of the same as we consider schools going back and so on. Let's absolutely do everything we possibly can. I think broadly those would be the comments from me, Ian. Thank you very much.
Thank you, Jonathan. And I would reiterate on the testing, an amazing job has been done by the team to roll out 4 testing sites across all our major towns, and we're looking for sites in Towcester and Brackley as well. So it really is going to be it's been a marvelous piece of work to watch that rolled out, and testing is going to be very key to to getting control of the numbers within the county. So I completely concur with what you said, Jonathan, and just add that bit about the mobilisation has been very impressive in the county, full stop. Now, so subsequent to that, we did have some written questions. What I'm proposing to do is I will go to the person who's asked the question, unless there's hands up at the moment, there aren't. So we'll go to the written question. So Laura Coffey from BBC Radio Northampton, are you there? You asked a question.
Hello, yeah, hi. So I just...
Sorry, I apologise. Carry on.
I was just going to say, I wanted to just, the question that I'd asked, the written question, was just to find out more about the regional testing centre. I just then have a couple of additional questions about how many people in total are self-isolating from the Greencore outbreak. And have those outbreaks that have been mentioned today, the additional outbreaks, so that's 4 additional outbreaks in workplaces. Previously we knew about 3. Have those outbreaks been identified through the mobile testing sites at the industrial estates like Grange Park? And also, this is a question for Assistant Chief Constable, who I see is on the call. Do you think the regulations will be in place before the self-isolation period is up? Because those still haven't been published yet.
Thank you, Laura. There's some comprehensive questions in there. In terms of the regional test centre coming to Kettering, the site has been confirmed, and it will be at the Kettering Conference Centre, and we're waiting for some build dates for that. I will pass over to Lucy to answer the second part of your question there, and then I'll come to James, if I may, after that. Lucy.
Thank you, Councillor. Could I just ask everybody to mute themselves as well if they're not talking, because there is some background noise, if people don't mind, please. So from a point of view of the information about Greencore employees, obviously we know how many Greencore employees have been impacted, and obviously we're in the process of making sure that we have clarity on the number of household contacts that they have. Obviously it's quite challenging from a point of view of collation of that information, because Greencore obviously only hold the direct employee data. So we work with Department of Health and Social Care, who are obviously leading on the fact that they need to be able to collate that information. But we've already started to work with the Greencore employees to be able to clarify what the position is.
Thank you very much. Can I bring James in on that second question, if I may, James?
My colleague ACC Pauline Sermon, who's on the line, will pick that up.
Pauline, hi, sorry.
No problem at all. Based on the question about will the legislation be in, or do we anticipate the legislation will be in before the end of the self-isolation period, we anticipate that it will be, and we've reviewed the processes that would be necessary depending on the content of the legislation.
Thank you very much. Thank you. Laura, I was going to bring in Lisa Hyde to talk about Kettering specifically, because that was mentioned in your question. Lisa, did you want to make any comment on that, on the location of the site, the testing site?
To just reiterate, Ian, what you've said, regional test centre, as we've said, will be located at Kettering Conference Centre, Thursford Drive. Currently working on the planning and the logistics around that, with a target date hopefully by the end of September, early October.
Thank you very much. Thank you for that confirmation. Sarah Ward, are you there, Sarah? You did ask a number of questions as well.
Yeah, can you hear me?
I can. Yes.
Yeah, lovely. Yeah, my first question is, the cases in Kettering and Corby have been rising again in recent days. Does the Director of Public Health know why this is, and could it be being fueled by a considerable workplace outbreak that is as yet undetected? And I've got a second question about whether any businesses besides Greencore have decided to undertake their own private testing. If so, can the company be named or the town in which it is located? That's it.
Thank you, Sarah. Lucy, did you want to take those questions? Thank you very much.
Yeah, absolutely. So from a point of view of Kettering and Corby, one of the things that we've talked about is that increase in the younger age group. So Kettering in particular, the recent increase is very much focused on younger age group, and similarly in Corby we're seeing an increase certainly in the under 20s. So again, we're making sure that we're linking in with appropriate schools and colleges, higher education establishments, to make sure that people are aware of the messaging, but also as they go back into school, etc., that they're able to access the information that they need to make sure that they're obviously socialising, doing whatever they do in a safe way. Obviously, we've already been engaging with employers, because I recognise not everybody under 20 obviously is in school. So again, we're able to reinforce the fact that there's a particular area or group of people that are of concern at the moment, and again make sure that we're tailoring our messages accordingly. We do realise that, you know, younger people won't necessarily engage with the same media information and the sort of media platforms that older people will. So again, making sure that we've got social media and various other approaches to communicating those messages. I can't remember your second question, Sarah.
It's about whether any other businesses besides Greencore have decided to undertake their own private testing.
So not to my knowledge, and obviously that would be information that would be party to that organisation and Public Health England and myself only. Obviously, if the outbreak were ever at a point where the numbers or the information that we had about the routes of communication posed a risk to the population, as I've said a number of times, we'd of course share that. But at the moment, if you're asking if there's a concentration of outbreaks in Kettering or Corby or high numbers, the answer is no in both cases.
Okay, lovely, thank you.
Thank you, Sarah. Thank you, Lucy. And of course, it's always worth pointing out that private companies may undertake testing under their own steam, because that's, you know, what they're capable of doing, and of course that's private information largely as well, I would imagine. So thank you for that question, Sarah. Ben Schofield from Look East, you're up next, sir. Are you there?
I am indeed. Hello, good afternoon, everyone. I think a couple of my questions have probably already been asked and answered, but
a lot of the Greencore stuff has largely been covered, I think, already, but if you've got any other points.
Yeah, sure. I was going to ask Lucy Whiteman, obviously you mentioned young people. What is your advice to pupils and staff at schools with regards to face coverings?
Yeah, so I recognise there's been some quite complex and conflicting messaging around this, which is an absolute source of frustration, certainly for me. I'm clear that Northampton Borough in particular is an area of intervention, and that schools with secondary school age pupils should be absolutely advocating for the pupils to be wearing face masks, particularly those that obviously have areas because of the age of the build, etc., where they've got pinch points or they've got high use of areas of traffic, narrow corridors, etc. And I've had a number of conversations in the last 2 days with head teachers who are fully supportive of that, particularly in Northampton Borough. From a point of view of the wider county, obviously I would be encouraging people to, particularly at secondary school age, be utilising face masks where, again, they've got those pinch points. Obviously, each school have undertaken a risk assessment and therefore will be able to ascertain whether that is more of a requirement in certain settings than it might be in others. But it's one of those things that we know we have some evidence now that if you are infected, it reduces the onward transmission. It doesn't necessarily protect someone who's uninfected. But key in schools is not just obviously reducing the impact on the pupils themselves and the staff, but obviously most pupils would then obviously go home, and because they will need to be cared for because of their age by close family members, the likelihood of transmission is higher in children than in adults because they're not able to fully self-isolate in a room, you know, etc. They will obviously, dependent on their age, need support. And obviously, particularly coming into winter as we do, and knowing that we've got still very old and vulnerable people within our population, children are a sort of a germ receptacle. We know this, we see it with flu every year, that transmission happens through young people and again exposes our older and more vulnerable population. And we certainly want to make sure that, again, if we can mitigate risk in school, then we're also mitigating risk, particularly for our vulnerable population outside of school.
Could I ask a quick follow-up to that in that case? How, with the return of schools imminent, I'm assuming it's next week in Northamptonshire, forgive me for not knowing the dates, I know my own children's dates. How worried are you about the return to school next week? I
do have concerns. Any significant event that pulls together a number of people in an inside environment, you know, with, as I said, identified pinch points, etc., and where social distancing and face mask wearing and hand washing, etc., is not necessarily something that they'll be cognizant of, and indeed practicing on a regular basis. You know, this is a high risk setting. We identified that weeks ago from a point of view of our outbreak management plan, and therefore we've been working with the schools cell and the head teachers to make sure that those risk assessments have been undertaken, and that wherever possible we've got that risk mitigated. It is likely we will see cases, and it is likely we will see outbreaks, but obviously what we can do is make sure that we've got appropriate processes in place where people can escalate concerns, where we've got clear lines of communication with Public Health England, who obviously remain the first port of call for suspected outbreaks, so that we've got clear information in a timely fashion to enable us to take action. But it is a concern, but it is also a concern that people aren't returning to education, and children clearly do need to return to education. So we've got to balance this.
Thank you very much.
Thank you very, and it's worth pointing out that all head teachers have been written to throughout the county, I believe, and in the district of Northampton and the borough of Northamptonshire as well, to advise them of that guidance. And I'm sure they're more than aware of what they need to do in the coming weeks before they reopen. Ben?
So can I just add as well? So yes, obviously the one thing to be cognizant of is 95% of our schools have remained open in some way, shape or form through the pandemic. So many of them are already practiced at you know, the measures they need to take. It's just the sheer scale, obviously, that poses a concern for me. And as I said, we've got to make sure that we're prepared for that, and we're working hard to make sure that everybody's got the information and the processes in place to do so.
Thank you very much, Lucy. Thank you, Ben. You did have a couple of other questions, Ben, but I'm pretty sure they've probably already been answered, if that's okay, in the main presentation. So if you're happy, I will move on to Kevin Nichols from the Northampton Chronicle and Echo. Are you there, Kevin?
I am, Ian. Yes. Can you hear me?
I can hear you, yes.
Thank you very much indeed. Yeah, I did have a number of questions. Like you say, most of them do seem to have been addressed now. Just one on Green Corps. I'm slightly puzzled at the number of positive cases are going to Moulton rather than to the residences. Can we be sure that all the positive cases are from people living in Northamptonshire, or would there be any from outside at all?
There are 2 from outside Northamptonshire of the positive cases.
Can you tell us where from?
No, not. I've always been very clear about the fact that there is a requirement to suppress data, and if it's under 5 in particular is the threshold for information governance reasons, it makes those people potentially very identifiable. So I can't share individual areas, but I can assure you that obviously they've been followed up through the contact tracing process. And I can also state that there are a number of employees that are affected by the requirement to self-isolate who live outside of Northamptonshire. And again, we're liaising with public health departments in those areas affected to make sure that they have all the information they require.
Right, okay. There's no chance they would have been from any of the other areas that were affected by high infection rates, such as Leicester or anything like that?
As I said, I won't be commenting on individual case level data.
I think you may have reached the end of the road on that question, Kevin. I'm sorry to say, but
no, that's absolutely fine. Yeah,
you had a number of other questions there, but I think you're fairly content that you've had all them answered in the information that you've had already.
Yes, I have. Yeah, thank you for that, Ian.
Thank you very much. Thank you, Kevin. So we will come, if that's okay, next to, excuse me for a sec, Neil Barber from ITV Angular. Hi, Neil, how are you?
Hi, yeah, good, thank you.
Again, I think some of these have been answered a little bit, the Green Corps bits in particular, but feel free to reiterate some of the other points that you wanted to make.
Yeah, so just one to Jonathan Nunn first off. Obviously, it's great news that cases are going down and it looks as though things are on the turn. How worried are you that people might start to think, oh, well, the problem was only Green Corps and I don't need to stick to the regulations anymore? To Lucy, would you advocate that food production sites like Green Corps take out their own private testing in addition to the extra testing that the council are offering? And do you have any particular fears about food production sites in terms of the cold and things like that? And just one final one to ACC Sturman, if possible. Did it frustrate you that last Friday it was announced that regulations would be in place to allow you to enforce the self-isolation period, and still a week on you can't do anything to make sure that people aren't leaving their houses.
Thank you for that, Neil. I'll come to everyone in order. So I'll go to Jonathan Nunn first. Jonathan.
Yeah, thank you. Thank you, Neil, for the question. Actually quite glad to expand on this a little bit, because I thought carefully before making the comment I made earlier, really, about potentially some early signs of good news. I think the reason I made that is because I do want people to know that their actions are making a difference. It's really important that we know that. And I know sometimes we might, as individuals in all sorts of aspects of our lives, wonder if our own personal actions make a difference. And actually, every single aspect of this is about personal actions. So I did feel it was appropriate just to reflect and to pause and to thank people for what they're doing. But the answer is I'm really, really worried, really worried. I think as human beings, if you give us an inch, we take a mile. Our tendency is perhaps to relax if we hear a bit of good news. And I don't exclude myself or anybody else from that. So you're absolutely right. I'm extremely worried. We certainly shouldn't be complacent. So the message, insofar as I'm placed to give this message to the people of Northampton, I would say, well done. What you're doing seems to be making a difference, but we've got to keep push. Let's really keep pushing all the basic precautions, from the hand washing all the way through to the avoiding car sharing, being really careful on buses, put your mask on before you join the queue, keep your mask on until you get off the bus and you're away from confined areas. All of these other things we've got to keep doing, because personally I am worried that now we just cannot take, I keep using this expression, we cannot take our foot off the gas.
Absolutely, I couldn't agree more with that, Jonathan. It really is important for everyone to, especially with the bank holiday coming up, that we adhere to the rules and what we have to do to make these numbers come down. Lucy, over to you, and then I'm going to bring in Pauline Sturman. Lucy, over to you for that second part of the question.
Thank you for the question. Very insightful question. So from a point of view of food production factories, again, we refer back to the outbreak control plan. We were aware, particularly because there were early signs in European countries, that food production environments were high risk for lots of the reasons that you mentioned. It's temperature, it's the closeness of proximity of employees. It's quite often these are old premises where social distancing is more challenging. None of those issues have been particular to Greencore, I will just reiterate, but we do know again that these are also workers who tend to come from areas where they may also share accommodation, they share car travel, as we know. We've talked about some of the risk factors that we identified with Greencore. So it's not just the environment, but it's also the way that the communities that work within those environments socialise, etc. So it is obviously an ongoing risk. Would I advocate for all of them to undertake private testing? Now, private testing is by no means cheap. So I've just put that out there. Greencore invested significantly, as I've said before, in their measures to make sure that obviously the scale of the risk was identified as early as possible and mitigated. That's one of the reasons that we've obviously got that at the moment roving mobile testing unit that's focusing on industrial estates, as well as to encourage people to have testing. Now, what's important is that Public Health England, when they get that testing information, they obviously look at the context that's collected from the test and trace information, and where there's a clear number of employees coming from one setting or another, that's how we're then informed that there's an outbreak, and that's how obviously the action that we take on that is triggered. Where obviously there is a requirement, because of the sheer scale of an outbreak, for testing to be taken at a large scale, because do remember it's not currently national policy for asymptomatic testing. We would only do that if there was a significant outbreak. Then obviously that would be arranged through a mobile testing unit. As I said, Greencore took upon themselves to do that privately to ensure that they could do it as rapidly as possible. And for that, I'm very grateful. It is not something I'd necessarily advocate, but it's something that obviously we need to make sure that we've got adequate access to national resources like the mobile testing units to facilitate testing at scale and rapidly should the need arise.
Thank you, Lucy. A very comprehensive answer there. Pauline, can I come to you from the police perspective on that third piece of the question? Thank you.
Certainly, thank you for the question. So in relation to any frustrations really a week on post the legislation supposing to be laid, one of the things that I think all of us on this call have seen through the COVID-19 period is that it's a dynamically changing circumstance. So therefore we have all collectively got used to being able to flex both our individual responses and how we come together collectively to respond to that. So therefore, the collaborative processes we already have in place enable us to flex accordingly and make sure that we have that appropriate response based on what we're presented with.
Thank you very much for that answer. Very good. Thank you. I've got a couple of hands up as well. I'm going to go to them next. So Alistair from the Cronin Echo. Sir, are you there? Appears not at the moment. Jack Duggan from the Cron. Are you there, sir?
Yeah, I'm here. Hiya.
Hi, Jack. How are you? Thank you for coming on the call.
Yeah, I'm sure Al's there. He's definitely around, but he's must just have a mic issue, so I'm sure he'll be able to.
Okay, well, we'll come to you
ask a
first.
question in a minute. Yeah, that's fine. I'll. My question was just about the sort of status for Northampton, and is there any sort of indication whether Northampton will be downgraded now that the cases are coming down, and when you might sort of know about that? I know the sort of cases, the Public Health England report usually comes out on a Friday, and it's still not out for this week. Well, it's not publicly out anyway, but yeah, any guidance you have on that would be much appreciated.
Yes, certainly. I'll come to Lucy, but as Jonathan said, we're definitely not out of the woods yet. There's still some significant work to be done in Northampton and Northamptonshire to get these numbers down, and we can't be complacent. Lucy, over to you.
So I would not anticipate Northampton coming out of intervention until at least the 14-day period of self-isolation is completed. And again, I would anticipate it lasting, I would have said at least a week, if not a fortnight after that, simply because we need to make sure that the impact that's anticipated from that isolation is indeed playing out in our figures, so that, you know, we are confident that there's no further cases associated with Green Corps employees. From a point of view of the longer term ambition, yes, we're likely to see that change at some point. Absolutely would hope so, bearing in mind the level of activity we've got to mitigate risk happening locally. But we've got to remember that pre-Green Corps, we were already an area of concern, and our rates are only back down to being at that pre-Green Corps level. So as Jonathan quite rightly says, there's still a long way to go for us to come off the watch list completely. And that's why people really can't be complacent. And we just implore people again to continue with the good work. We've seen it start to have an impact, but it was still not out of the woods.
Thank you very much, Lucy. Jack, did you have a subsequent question to that, or are you?
No, it's just sort of obviously that the main thing, because of the status, means that schools in Northampton Borough have to wear masks in communal places. So I'm guessing that schools are going to probably be, they're not expecting that to change before they reopen, certainly not next week, obviously. And if you're not expecting it for at least, you know, potentially a month away, then
no, I mean,
they're going to be wearing masks for a while.
Yes, while we're an area of special interest, as they say. Yeah.
Yeah, and then would that would the masking change if we went down to an area of concern?
I don't know the answer to that, Lucy. What you may know the answer to that. I mean, I presume it would change, but the national guidance is quite clear on face masks anyway, isn't it, Lucy?
It is, but again, you know, Jack's right, for areas of intervention, it's quite specific. The rest of it obviously would be based on the risk at that point in time. So, for example, if we came out of intervention, but we continue to see the trends that we do, where actually we've got the greatest increase in the under 18s, even if our overall rate comes down, if our case focus is still in that age group, I'd still be advocating for the use of face masks until we make sure that we get on top of that as a cohort.
Absolutely. Everyone has to play their part, including the children at school, effectively, in order to get control of these numbers. Alistair, are you there from the Cronin Echo? Are you?
Yes, hello. Is my microphone working now?
It is. I can hear you, sir.
There we are. Thank you very much. Sorry, it was to dig more down into the schools thing, if Lucy could help me with this one. We've said that the threshold for sort of publishing what a outbreak is about 5 cases, so to speak. When it comes to schools going forward, is that going to be the same? What will the threshold be for telling parents, for example, there's an outbreak at the school? And what will be the threshold for telling, say, us here at the press conference, doing another announcement like we did for Green Corps?
So from a point of view of school outbreaks, you know, clearly because of the way that schools are going to be operating, they have to inform the whole bubble, or whatever the, you know, sort of arrangements from a point of view of limiting pupil interaction would be. So that would obviously happen within the school. So it's therefore quite likely that that would end up in the public domain anyway. So again, we'd be working with that school to make sure that they were happy with that information being released. But it will have to be on a case-by-case basis. But because of, as I said, the way that schools will be operating in bubbles, it is more likely that you will see a higher number of people having to self-isolate because of basically that approach.
Thank you very much. Can you, have I got a second one if that's okay?
Yeah,
just one from a colleague more than anything else. So we've been seeing in the past, say, around 4 weeks or so, the number of cases of, say, 0 to 19 years old in the county has been rising. I was going to ask, what do you think's led to this? Is there something particularly leading to this age group rising? Because it might be one of the fastest in the county at this point, as far as I can see.
It's highly likely to be school holidays. I mean, I appreciate that obviously children have been at school for some time now, but I think whilst it's been term time, again, parents have been, I think, a little bit more restrictive in their movements. Obviously, as lockdown has eased, as we've seen things like, eat out for less happening, people have been going out and socialising more, and that's certainly more evident if you just sort of walk around the county. And as I said, these are messages that children won't necessarily retain from a point of view of they naturally want to be in close contact with each other, they naturally want to play, and they will do so both indoors and outdoors. So again, whilst they're playing outdoors, that's great, but when the weather's like it is today, for example, they're quite likely to still be seeing their friends indoors. So it's about us making sure that we are providing those messages in a way that are more memorable to children. We recognise that at the moment we focus very much on more adult-based communications, and we've got our team working with the school cell on that as we speak to make sure that schools have got a resource pack that is appropriate for the age that they're supporting. But again, the messages need to be back out to parents as well, to implore them that they obviously provide some restrictions around movement with the children, recognising that obviously this has been going on for quite some time. So striking that balance, providing safe environments to children, for children to socialise in, but obviously recognising that we will, as I said, see this likely increase further as children do return to school as well.
Thank you for that, Lucy. I think it's going to be an interesting few weeks from a public health perspective, certainly. I'm looking around the room to see if Jack Duggan from the Cron. I know you had your hand up, but it's come down again.
Sorry, yeah, I just thought I'd update that.
Thank you very much. I'm just looking around the room. There don't appear to be any further questions, in which case I think I will shut the meeting if that's okay. Sarah Ward. Hello, Sarah.
Hello. Hi. Just a quick last question. Can you hear me?
Yes, we can hear you. Thank you.
Okay. Will schools close if there is an outbreak? That's it.
Very succinct question. Thank you very much, Lucy.
It depends on the size of the outbreak. As I alluded to earlier, most schools are operating in a sort of a bubble format, with the sole purpose of restricting any transmission of a positive case to as few a number of pupils and staff as possible. So in the first instance, it would be the direct contacts within that bubble that would be self-isolating. Obviously, if we had a number of cases that were linked, again, in the same, according to the definition of an outbreak, then we would take steps as appropriate at that point, and also dependent on the setting, again, because it depends what additional measures you may be able to put into a setting, and that again very much depends on the physical build of the building in order to further mitigate any risk. So I can't definitively say that we won't have schools shut if there's an outbreak, but at the moment it would have to be taken on a case-by-case basis. But schools are working very hard to make sure that that bubble system, that restriction of exposure is, the first port of call.
I think it's worth reiterating your earlier statement about 95% of schools have been open the whole time through this pandemic, and they've got very good at managing their sort of controls and things like that, ready for this events next week. So I think a lot of them will be well prepared. Sarah, did you have another question, or was that it from you?
Just to follow on from that then, so if a child is in a bubble that has coronavirus, a case, does the whole family have to self-isolate for 2 weeks?
So all of the requirements around contacts and cases would remain exactly the same. Okay. So their household contacts, yes, would of course have to self-isolate for 14 days and the case themselves for 10. That's the current guidance. That may change, but obviously at the moment that would be the requirement. And any contacts identified within that bubble would also have to self-isolate for 14 days.
Thank you for reconfirming that. I'm quickly looking around the room to see if there are any other questions. I can't see any, in which case I'm going to close today's meeting. Thank everyone for attending. Thank you very much for the questions, and I wish everyone a very hearty and happy bank holiday weekend within the rules, of course, and the guidance. We must all remember to follow the guidance if we're going to get these numbers down, and we're all working together to do that. Thank you very much, everyone. Have a lovely weekend.
Thank you.
Thank you.